There has been a dramatic reduction in the number of COVID-19 cases in Karnataka and its capital, Bengaluru, as that devastating second wave does appear to be leaving. But there is, of course, no room for complacency. There is a third wave coming. Joining us, one of the people responsible for making sure the state is as ready as possible for that third wave, Health Minister Dr K Sudhakar. Dr Sudhakar, thank you so much for joining us today on NDTV. The coronavirus has gone through a dramatic path in the months, the years of its existence. The latest point of focus now is the Delta Plus variant. How serious is the situation of the Delta Plus in Karnataka? And what is the state government actually doing about that? How seriously is it taking the situation?
Regarding the Delta Plus variant, I think one need not be as scared or skeptical about it, because between the Delta and the Delta Plus, there are a couple of theses put forward. But in my opinion, that only the therapeutic things will be different from Delta and Delta Plus. Only the monoclonal antibodies does not work with the Delta Plus variant. That is what my clinicians have told me here. And as it is in Karnataka, it has only 2 cases are reported. Both the cases are asymptomatic, and one of the contacts of the 2 cases that we found in Bengaluru, out of 7-8 contacts, only 1 person is being positive. The rest, everybody tested negative. So as of now, there is no concern. However, the precautionary measures and continuous monitoring by using our genomic sequencing of these samples are on in Karnataka. We have done almost 600 to 700 samples across the state in NIMANS, and we are the first state, I think we are establishing almost 6 genomic sequencing labs across the state in 4 medical colleges and 2 district hospitals. So we would not just the Delta Plus, any future mutant varieties that may come forward in the future, we would like to continuously keep a track and monitor these strains.
As Health Minister, with the inputs that you've been getting, the different studies and the data, when do you expect the third wave to reach us?
See, before any wave coming in, as we all know that every pandemic, like in Spanish flu that we have witnessed in 1918 and 1919, there were about 3 waves, but the second wave there also was the very steep one. Similarly, here also we have witnessed the second wave to be such a huge surge across the country. And now, since that the Delta variant was first witnessed in India, this has been the most contagious and virulent variant in the world today. This has gone to other countries also now, and we are witnessing the same kind of development in those countries as well. So nevertheless, regarding the third wave, if I have to say that only the 2 doses of vaccine and the COVID preventive behavior of individuals can prevent any successive waves, in my opinion. So this has to be the order, and we all have to be very, very conscious about our behavior. Even in spite of we taking 2 doses of vaccine, we need to continue this till more than 70% of the population in the country is inoculated.
Do you have any time frame for the third wave in terms of when it would actually arrive?
Any successive waves, Maya, in my opinion, and the clinicians report according to them, we have a TAC committee where they have predicted it takes minimum of 100 to 120 days for a new wave to break out. So we need to keep that. So we have a 120 days window. We need to ramp up our vaccination process as high as possible. And that is exactly what Karnataka is doing. If you have seen few days back in the vaccination Mela day, we were the highest in South India and we were the second highest in the entire country. So we inoculated almost like 11 lakh 26,000 people in Karnataka, and even today it's a great day to tell you and announce that Bengaluru alone has inoculated about 50 lakh people today. So 50 lakh doses we have administered in Bengaluru alone, and we have completed 2 crore 12 lakh in the state, where about 40 lakh people have got both the doses, about 1 crore 80 lakhs they have received single dose. So this is a good progress that Karnataka is spearheading in inoculation. We have taken it very, very serious. We have ramped up about 13,000. We have created facilities in government sector alone, and another 5,000 in the private sector. You know that the private sector in Karnataka, significant presence is there. So together, cohesively, I think we should inoculate the entire population within this year end. That is, this is our ambitious target that we have, and if you observe now, the trend is reaching there.
Over 2 crore vaccinations in Karnataka, over 50 lakh vaccinations in Bengaluru. Those are impressive numbers by themselves. But can that momentum be sustained? That really is the big question. Can it continue this way?
Yeah, every day we are on an average, we are vaccinating minimum 3.5 to 4 lakh people. So even in that pace, we can vaccinate almost like 1.2 to 1.5 crore in a month. So we have set our target clearly, and we have a strategy in place. We have also identified a vulnerable and the priority groups, like those from the health workers and health worker family will be the priority one. Similarly, the police and their family members, other frontline departments like education, rural development, urban development. And now we are also trying to vaccinate and prioritize the students who are undergraduates, since if we have to start their colleges, education, higher education on priority, we need to vaccinate them. And similarly, we have to vaccinate the parents of those children who are below 10 years. Like this, we have prioritized the vulnerable groups, and on a strategy we are going forward in Karnataka.
You spoke about the third wave arriving within 120 days. Are you confident that Karnataka would have vaccinated enough people by then to be prepared for that wave?
I think in another 3 months that we have, we will be vaccinating another 3 crore in my opinion. As of today, we have vaccinated 2.2 crore. That will take us about 5.2 crores. It is a really great number. In my opinion, more than 50% of the population by then, they would have received 2 doses of vaccine, and 70 to 80% of the people would have received at least 1 dose of vaccine, which is still good enough for me to prevent this third wave. And I really honestly feel that third wave will not be as scary as what we are all anticipating it to be.
Another huge area of concern are reports, are statements made that children may be more vulnerable in the third wave. Have we been seeing a higher number of cases among children, and do you anticipate the third wave will hit them harder?
Yeah, we are all concerned. You know that children are, the precious ones, and when something happens to children, definitely the entire community will feel bad, and we are all skeptical of how it would affect the children. In the experience that we have witnessed in the last 2 waves of this pandemic, there are children who were infected, but we have never seen a serious case. That means a child going into ICU or on a ventilator. It has never happened, at least in Karnataka. There are some children who will be having other comorbidity factors. Such children need to be monitored, and we have to take utmost precautionary measures from now on. That is why our government, our department has taken a new strategy of addressing these issues and trying to reach out to those vulnerable children at the moment and try to monitor their health parameters from now on. And such parents also will be on priority, will be vaccinated as well.
And there was that struggle for hospital beds. What about beds, hospital staff?
Yeah, Maya, we hired almost 1,740 doctors, direct recruitment we did last month. And again, yesterday we have passed in another order of compulsory, rural postings and the government postings for those students who have been on a government quota, who finished their MBBS this year. We have hired about 1,950. Yesterday the order is issued. So only the doctors alone, we are ramped up by 4,000. And similarly, in sync with that, we are increasing the number of nursing and paramedical staff as well. And not just hiring, we are also training them to address the situation about the pandemic. Now the doctors are quite equipped, because in the first wave everybody was taken by surprise and fear. But this time they have enough experience, and those trained doctors are training the new budding doctors and the new nursing and paramedical system. That is the way forward. We are all learning. The virus is new, the medicines are new. We are all having a new experience, and every day, every moment, this virus is mutating itself. After mutations, successive mutations always dilute in its nature, but this has been quite a contrast, because from the first wave strain to the second strain, it really had more contagious and it was more severe. So we don't know exactly, if you ask me, how this virus is behaving, but we need to continuously monitor and track the behavior of these variants or the successive variants and address accordingly.
And with all this talk of vaccination, is there going to be enough vaccine? There were shortages in the past, there have been challenges in the past. Will there be enough vaccine to vaccinate enough people ahead of the third wave?
Yeah, there is a continuous supply of vaccination from the government of India, Maya. I don't want to politicize the issue, but I would like to put it straight, because in the history, no vaccine has ever supplied by government of India. This health subject is always belongs to the state. We give almost a dozen of vaccines up to 10 years of age. All these vaccines are supplied by the state, but still, as a great gesture by our Honorable Prime Minister, the government of India is supplying the complete COVID vaccine free of cost to all the states. And Karnataka today, we have always a reserve of about 10 to 12 lakhs every day. That is how we are planning to do minimum of 4 to 5 lakhs every day in the state. I am confident that the vaccination supply will only increase in the coming days, because we are witnessing the homegrown the vaccine, that is Covaxin, also is increasing their capacity to manufacture, produce, and similarly the Bharat, that is the Bharat Biotech and the Serum Institute in Pune, they also are having one more vaccine today. They are also trying to increase their production. So in my opinion, by August, all the companies together, they can produce almost like 10 crore in a month, 10 crore of doses. So definitely by October, we will be in a great situation. The country, though we are about 135 crore, I think this nation has even shown the world how fast a vaccination can happen. And when you see 80 lakh in one day, it is a world record. No country can even ever imagine to vaccination in single day of 80 lakh people.
There have been many changes when it comes to the gap for the first and second dose of the Covishield vaccination. Now, of course, it is 84 days. And many people have the question whether this was decided because of the shortage of vaccine or for medical reasons. Is there any chance of this 84 days changing?
No government can afford to take a political decision on vaccination, Maya, first of all. I would like to put that straight into this thing. It is based on the medical evidence. As we know that vaccine itself is quite about 9 months old. So the study into it, it takes this much of time. Those people who had taken their second doses, after 12 weeks to 16 weeks, they have found out that in the Oxford University, the study says that the antibodies and the resistance to fight this infection is much stronger. So it is a medically, medically proven thing, and that is why the scientists have given this kind of a report. Based on the experts' advice, I think government has decided rightly to administer the second dose between the 12 weeks to 16 weeks after the first dose inoculation.
It is, of course, inevitable that things open up once again. Bengaluru is seeing crowds elsewhere in Karnataka as well. More and more people are coming out as lockdown restrictions are lifted. As Health Minister, what do you feel about this? Are you concerned? Are you frightened that the number of cases will surge once again?
Honestly speaking, as a Health Minister, I am really scared and by seeing the kind of people movement here. So it is like back to normal. They have forgotten that there was a just wave 2 a few weeks back. So that is the tendency, that's the normal tendency of us. But I would like to only caution to the people that we do not know exactly whether it is the end of the second wave or whether it will, the third wave will hit us in 3 months. We need to be utmost cautious and sensible enough to follow the COVID preventive behavior. In addition to it, we need to concentrate on getting our second 2 doses of vaccine at the earliest. Without these 2, if somebody is going freely, it is inviting for definitely a danger.
A huge amount of caution needed ahead of that third wave. The need to get vaccinated, the need to follow COVID protocols like masking and social distancing. Very, very important indeed. Dr. Sudhakar, Health Minister of Karnataka, thank you very much for joining us here today on NDTV. Thank you.